So Metachromatic Leukodystrophy, or MLD, is a neurogenetic disease. It is a lysosomal storage disorder due to an insufficiency of a lysosomal enzyme. And due to this insufficiency, we find an accumulation of toxic metabolites throughout the body. They really accumulate throughout the body, but we see the first and most damaging effect on the vulnerable cells of the central and peripheral nervous system. So the patients suffer from progressive neurodegeneration and premature death. And we can distinguish several types of onset based on the age of onset. And we know that the earlier the onset, the more rapid the progression. But all patients, all children affected, share the same disease trajectory. That means they first show a completely normal development and then enter a stage of developmental stagnation. And this stage is really clinically subtle. The children just stop to learn new abilities, to reach more milestones, before they enter then a phase of neurodegeneration when they really lose abilities like the ability to walk, to talk, to swallow, and finally to breathe. So until some years ago, the situation was that the children presented with symptoms of MLD at our pediatric hospital. And really the only thing we could offer was then symptom relief and palliative care. So there was really a change of paradigm for this disorder when the gene therapy was approved a few years ago in the European Union. And this gene therapy shows a high efficacy, enabling an almost normal cognitive and motor development for the children if it is applied in the presymptomatic stage of the disease. That means before the onset of clinical symptoms. And this is approved for early onset MLD forms. For later onset MLD forms, we have decades of experience with the allogenic hematopoietic stem cell transplantation that also shows great results when administered in the presymptomatic stage. The next step really is to diagnose the patients before the onset of clinical symptoms to be in time for treatment. So far the situation is that a child presents with symptoms to the clinical hospital in Tübingen, and we are most likely too late for treatment. However, these children have siblings, completely pre-symptomatic, and sometimes we are in time to treat these siblings. However, this situation is very burdensome and quite challenging for the families. And really the only way to overcome this challenge is to implement newborn screening. So we were delighted to participate in a cooperation for the first newborn screening pilot project for Metachromatic Leukodystrophy. And within this pilot, now 7 newborns have been identified in time for treatment. So this really bears the hope that soon there's no child diagnosed too late to treat. The role of ERN-RND is quite key here to provide a platform and bring European experts together to develop guidelines and recommendations on management and treatment of MLD. And this is quite important when you want to implement an innovative therapy like the gene therapy from a clinical trial setting into routine clinical care. Moreover, it facilitates treatment eligibility boards together with the MLD initiative. And in these boards, every single case is discussed on when and how to treat the MLD patient. And this is quite important, especially regarding the newborn screening cases.